pollution has been long linked with complications among pregnant women. But is pollution, which has now become an annual occurrence, has this increased these complications and led into an increasing number of infertility and miscarriages among women? We spoke to a number of experts and doctors who have been suggesting that on ground it seems that the cases of miscarriages and infertility have only doubled due to pollution. What can be done in this situation? What are the advices from the experts? We have been speaking to some of them. Here is what they have to say. Is pollution one of the causes for infertility in women? Is pollution responsible for some of the cases where we are seeing miscarriages happening? Of course, we have heard about the adverse effect of pollution, but is it really affecting the reproductive organs of men and women? Now, to answer all these questions, I am joined by an expert, Dr. Jayasree Sundar, who is in fact a renowned gynecologist. My first question to you is there really a link? When there are multiple studies we have seen international, but when it comes to India, we know a lot of adverse effect of pollution. Can the pollution be linked to infertility in women and miscarriages?
Yeah, absolutely. Pollution is definitely linked to infertility and miscarriages, both in males and females. See, because both the eggs and sperms, these are dividing cells. So in our body, when we are grown up, nothing is actually in action, but only our gonads and gametes are in action right now. So they need persistent source of nutrients. They are in active mode right now. So whatever we are eating, whatever we are inhaling, whatever is going inside our body is actually having a major effect on the quality of the gametes. So similarly, if there is rise in air pollution, there are rise in toxins, or the tobacco, if we say smoking, if we say all these things, they have some chemicals in them which when inhaled inside, they go definitely directly to the ovaries, to the testes, and in the life cycle of the egg and in the formation of the sperms, they have a major impact. There have been studies in which they have actually seen that there are certain chemicals like benzene. It is quite commonly present in tobacco smokes, vehicle emissions, industrial emissions. So that benzene, when they actually measured it, it inside the follicular fluid of the ovary, the egg which stays in that follicle. So the females who were having high levels of benzene in their ovaries, they were having less egg production, they were having less formation of embryos, and their success rate in IVF was also very less. So there have been clear-cut studies. Air pollution is definitely linked to infertility. It is definitely linked to miscarriages. There is no doubt in that.
When in your experience, when it comes to your patients, because it's an annual problem issue, the pollution. So have you seen that whenever the pollution comes, the issues increases, miscarriages increases, the issues among women increases? The percentage, if you could, the number, if you could tell us.
We definitely get a higher percentage of females who are getting spotting during pregnancy. In last 10 days, if you will ask me, almost I have gotten 4-5 females who were pregnant and completely asymptomatic pregnancy, and they have started having spotting and bleeding without any reason. So in a way, obviously we know air pollution is a risk for miscarriage. So they are having symptoms. In case it is not controlled, or if they are not taking proper care, or if they have to travel outside a lot, they are prone to miscarriage. So we always advise them, if you are pregnant, stay indoors, use air purifiers, avoid yourself from being exposed to too much of pollution.
Coming to that, if you could tell us, pregnant women, what are the tips that could be, or advice that you would give to a pregnant woman?
So all the pregnant women, we advise that they need to stay indoors. Stay away from major roads or the areas where there is too much of vehicle to and fro. There are too much of industrial emission. So try to stay indoors, use air purifiers inside, and avoid any kind of emission. In fact, tobacco smoking is also one of the reasons. Pollution and the tobacco smoking is more or less the same. So in that case also, that is also very detrimental. Avoid from obviously active smoking, and also protect yourself from passive smoking.
So those were some of the advices and tips that has been given by Dr. Jayasree. In case you are pregnant, you're carrying a child, then it requires you to be extra careful when it compares to other population. There are multiple international studies that have shown that how pollution is linked to infertility in men and women. Also, it could lead to miscarriage. But what is really the situation on ground? Now, there are experts who have been suggesting when you compare it with the urban and the rural data, the population in urban sector or scene has more such cases of infertility and miscarriage due to pollution. But is that the fact? Are there people actually suffering because of pollution when it comes to infertility, when it comes to miscarriage? To answer all these questions, I am joined by renowned gynecologist Dr. Jayasree. So, ma'am, thank you for speaking with us. My first question to you is that, is there a link? Do you, when you have a number of patients, when we talk about every year the pollution happening, do you see more cases of miscarriage among women?
Yes, there has been a significant increase in the number of miscarriages that we are seeing. Not only miscarriages, the number of babies who are born low birth weight. There is an alarming increase in that. Now, when you talk about low birth weight, means suddenly we see that the woman is healthy, everything is going on well, and in the end, the baby just does not want to grow. So sometimes people say, "Nee, ma'am, hamare to itne ultrasounds were not happening before. Why is it that we are doing?" But we are seeing that the blood flow stops to the baby. There is a decrease in the blood flow. The baby starts compensating, and we are now wondering why is it happening more often than we have ever seen before. One, obviously we are able to screen them better, and now as a mother in pediatric hospital, what we are trying to look at is what are the long-term implications of these babies. We are seeing that there's a rise in autism in children. We are attributing many factors to rise in autism in children, and one of that may be the intranatal hypoxia that happened, though hypoxia is never related to autism because it's not due to birth injury or anything. But is there any genetic variation that is happening? Is the PM 2.5 level so high that it is, because we do know that there is a mitochondrial alteration because of the change in the environment, right? So we really need to have a look at it, and every time just speaking about it when it is high pollution, right? Is it really going to help us? Like I always tell all the couples who come to me that when you have a baby, promise them a cleaner environment. Try in your own way what you can do differently, right? So when Diwali came, nobody said there will be an odd even. Right, because at that time nobody wanted to disturb the celebrations, but that is not going to help us in the long term. So definitely the particulate matter, every other pregnant woman is having cold, cough, every other woman, so obviously her appetite goes down, so that affects her long term implications. And also we have a lot of working women who are pregnant now, so the concern that arises is when they are traveling, how much pollutants they are taking in. We tell women to exercise, at the same time I tell her no, don't go out, right? Then I tell her don't go to the gym and exercise. So how do people exercise, right? So also we see there is a lot of metabolic imbalance that is happening, and there is a rise in insulin resistance that is happening, and we Indians are very insulin resistant as a population. I mean, Asians are the diabetic capitals in the world, and that is increasing the risk of miscarriage because it increases polycystic ovarian disorder, that increases the risk of miscarriage. So I am sure that obviously this much of pollution has never happened, so we really don't know how much it affects. But in the population that we are seeing in Delhi, we are seeing problems which we have not seen before. I mean, miscarriage, we know that only 30% of all pregnancies go to completion, but the numbers that we see and the number of miscarriages we see is much higher. Even so you can see how in Delhi the fertility clinics are booming up, right? One of the reasons is obviously people are delaying childbirths and other things, but definitely fertility is definitely on the decrease. Also, we are seeing a lot of women having premature ovarian failure. Now, this was never the case before, right? We call that a woman menopauses between the age of 45 to 55. But I am seeing many women going through the changes from the age of 35, 36, 40, right? And then we say that your egg quality is not as good, so then we should take donor eggs. So definitely we have created more problems for us, and whether we have an inclination to solve it is the biggest question we should be answering. We cannot always say that it is the government should be doing it or we should be doing it. But everybody can take a small step, right?
I know that it is difficult to come up with a number, but it's an annual thing. The pollution is an annual thing. So if you compare, could you give me a near about a ballpark figure of miscarriage or due to pollution when you have seen like a issue in women?
So if I talk about our practice, right? If I was seeing, say, in a month, if I would be seeing 10 miscarriages, maybe I'm seeing 20 miscarriages, a lot of chemical pregnancies which are not going to completion. Young girls who are just not conceiving. I mean, we are doing everything right for them. You then send them to the fertility specialist and their eggs don't respond. So there must be something that is not genetically working all right for them, right? Because we know that if I give this medication, the egg should be forming and she should be conceiving. And she's just 30. Right? But they don't conceive. Then you have to look at alternative methods. And obviously the number of times we are inducing. So definitely there is a rise in the... So obviously we Indians are very poor at keeping statistics, right? And if we keep the statistics, I think we are having a lot of trouble, right? So being in a private setup, it is really harder to pinpoint a reason or try to do a research, but definitely we try to educate our girls. That's the best we can do, right? So what can you do differently? So if you have to walk at home. If you go out, at least wear your N95 if you are wanting to protect yourself, because wearing a normal mask is not going to protect you against pollution. So and then I tell girls, get up in the morning and go for a walk. But how do they go for a walk early in the morning? Even I have stopped walking in the morning, which I used to do every day. So then I tell them, then okay, so you start walking inside your house, inside your corridors, start using the machines, so that you keep the control of temperature. Even when newborns are born, we are telling them to use these devices so that there is no pollution or the PM levels are much lesser, right? So as a population, if we don't think about it, what can we do better next year? It's not going to help us. Every year talking about it at that time and then stopping immediately.
But I have a question that we of course we spoke about miscarriages that you just said the numbers are only increasing. But if you go further with the newborn, are there like changes? You mentioned autism. Apart from that, do you think you can solely make some issues that are pollution itself is just responsible for that, the issues that you're seeing in children newborn?
As I mentioned, autism is one thing. I mean, imagine the lung development of children, right? So children do get sick, right? But the numbers who are coming and getting admitted in ICUs is significantly much higher than what we have seen before. Having fevers which are not responding to treatment. And look at the level of the toddlers. Where they are walking, the pollution is the highest, right? We at least grow up, we are taller, then you're not facing the same level of concentration of pollutants. So it is a very scary environment for them. Also the amount of mental issues that we are going to create for them, because these children, we tell them no school. Every time the solution to the problem is the schools are stopped. They are not going outdoors to play. They are on gadgets. So not only the physical development of a child is being affected, the overall mental and holistic development of a child is also being severely compromised, right? And we are seeing those effects in the children. I mean, they don't have much verbal communication. They are not interacting. They are not going out to play. They are only doing activities which are indoors, right? So we do see, I mean, when the women come with their firstborns, you can see a big transformation in the profile of the children, right? You cannot, and every time you see them, they are either coughing. So what is it going to do to their lungs in the long term? So we say cigarette smoking is injurious to health, but as a population, all of us are smoking at least 30 cigarettes a day. So how can cigarette smoking be injurious, right? And imagine the exposure at such a young age. We are being exposed to it at the age of 35, 40, right? We started at that. But they are being exposed at the age of 2, 3. And also there is a decrease in the sperm count and the quality of sperm in men also. We should not ignore that fact also. So that is also leading to a lot of cases of subfertility.
So
right?
you're saying it's not just women, but even men are affected too?
Definitely. Okay. Men are also affected because the sperm count is a big challenge. People who have had a baby easily the first time, when they try to conceive the second time, I see a big challenge in the sperm count of the man, and we have to go for further treatment for them.
One last question. You, of course, said about not stepping out. If you're pregnant, the person should not step outside. To avoid, basically. What are the other advices you can give to pregnant women or children?
So, for pregnant women, don't step out when it is early morning or late. But when the sun comes out, you need to step out, right? You do need the sun also, right? And what are the things that you can do different is obviously you try to eat healthy. That really helps. You try to eat nutrient-rich food. That really helps to improve. See, we need to basically boost up our immunity. Do breathing exercises sitting at home. Do the stretches and other things that can be done. And I say when you are not doing anything, try to look at ways where you can create a better environment for the next generation. We are all going to exist and go away, but what are we going to leave for our children is what we should be questioning ourselves. And I tell them, please work on that, and everybody come up with a single idea and come with it through the day, through the year, not just on one day, right?
So that was Dr. Jayasree, who has in fact very gracefully has told us what are the things that one should keep in mind if they are pregnant, and due to this pollution, how all that could actually affect an individual. With video journalist Ramashankar, this is Shan Elizabeth in Delhi for CNN News 18.